Our next topic is burns. Burns are injuries caused by direct tissue damage from exposure to either the sun, chemicals, thermal, like boiling liquids, and even electricity. Now, as you know, the skin is made of 3 layers: the epidermis, the dermis, and the subcutaneous tissue, that fatty, bubbly looking tissue. Now, after the layers of skin, we find fascia, muscle, and then bone. So in first degree or superficial burns, we have damage to the epidermis, the top layer. So we see dry with blanchable redness, meaning that when you press on the wound, the redness goes away. Now, second degree burns, called partial thickness burns, we have both the epidermis and dermis that are damaged. So the key sign to know is painful blisters, huge NCLEX tip. So write down these key words here: red, moist, and shiny fluid-filled vesicles, or basically blisters that often leak fluid. So just think 2 layers of skin for 2-degree burns, or second-degree burns. Now, third-degree burns are full-thickness burns. We have 3 layers of skin destruction: the epidermis, the dermis, and possible subcutaneous tissue, described as key terms: dry, waxy white, leathery, or even charred black color that is non-blanchable skin. Big key terms for exams. Now, 4th degree, also a full thickness burn. These are the worst burns by far, as they go through all the layers of skin down to the muscles and even the bones. A unique sign is the lack of pain, since the destruction of nerve endings from all the burn charred areas. Even though they may look similar to 3rd degree burns, these are far worse since they're far deeper. Now, for minor burns, like the 1st and 2nd degree burns, these do not typically need hospitalization and can be treated outpatient with wound care and dressing changes. Whereas major burns like 3rd degree and 4th degree, these are deadly medical emergencies requiring intensive care, which we'll cover in a moment. So first, care for minor burns. Say a client is cooking and then burns themselves, or say they spill a boiling pot of water on an extremity. So we always teach the 3 C's for pre-hospital care: cool water, cover the area, and clothing removal. So for pre-hospital care, C for cool water, key terms, is briefly soak the area. And no ice, no creams, and definitely no antibiotic ointment to open skin. The key term there is open skin. So this can lead to additional damage, and the creams, lotions, and antibiotics may interfere with the assessment from the healthcare provider. Now, the second C is cover the area with key term, clean, dry cloth. So write that down. This is done to prevent infection and more damage in the pre-hospital setting. And the last C is clothing and jewelry removal near the burn, if not adhering to the burned skin. Only the HCP should remove anything adhering to the burned skin. So please be sure to write that down. Now, Saunders mentions, the nurse instructs firefighters that in the event of a tar burn, which is the immediate action? Cooling the injury with water. Yes, that was our first C there. And the second question, for a chemical burn injury, the nurse instructs the employees that which is the first consideration in immediate care: removing all clothing, gloves, and shoes, and any undergarments. Just strip down like you're going skinny dipping. Now, for Kaplan, they mention discharge teaching to a client with partial thickness burns, or 2nd degree burns, on the hand. We wrap the fingers with individual dressings. This is done to prevent tissues from sticking together and causing further damage. Now for the big mama, the pathophysiology for major burns. These can cause massive tissue damage and cellular destruction, resulting in widespread systemic inflammation that increases vascular permeability or capillary permeability. Just really fancy words for leaky blood vessels that fill up the body like a water balloon. So fluid, electrolytes, proteins, and other contents just spill over into the interstitial spaces, or the third spaces. Clients end up with severely low fluid volume intravascularly within the blood vessels, as fluid and electrolytes escape and now go into the tissues. eventually progressing into deadly hypovolemic shock. That's severely low blood pressure that eventually causes death. This is why the #1 intervention for major burns in the first 24 hours, and big NCLEX tip, so write down these key terms: IV lactated ringers, or LR solution, and IV normal saline, that 0.9% sodium chloride. These two will help save lives. They are isotonic fluids, which we call isoperfect fluids, since they stay inside the veins longer than any other solution, as it closely resembles the chemical composition of human blood. Fancy words for it increases the fluid volume inside the blood vessels, increasing the blood pressure and saving your patient's life. So don't let the NCLEX trick you here. We're not administering 5% dextrose, that glucose in water, which is not an isotonic solution, and not 45% normal saline, or 0.45%. That's a hypotonic solution. Only isotonic solutions here. So write it down again: lactated ringers or normal saline. Biggest NCLEX tip. Hey there, nursing student, listen up. Did you know only 20% of our videos are here on YouTube? You're missing out on over 900 videos not on YouTube, plus 500 visual study guides that follow along every video, and a massive quiz bank to test your knowledge. All neatly organized in our new app. Try it for free. Visit simplenursing.com today. So Kaplan mentions, the nurse is caring for a client with full thickness burns covering 20% of their body. What is the priority of care after ensuring a patent airway? IV fluids. And Saunders mentions, extensive burn injury, 45% of the total body surface area. Planning for fluid resuscitation, the nurse should consider that fluid shifts to the interstitial spaces is greatest during which period of time? Between 18 and 24 hours after the injury. Yes, the key term here is before or within 24 hours of the injury. Fluid resuscitation is priority, with normal saline and lactated ringers are isotonic solutions. So please be sure to write that down. That will save a life, and it's the most tested. Now for the big signs and symptoms of major burns. These ones love to show up on exams. The key point is that in the first 24 hours, as cells burst and cellular damage occurs, the cells release potassium into the bloodstream, causing high potassium, that hyperkalemia over 5.0. So just think, potassium is priority since it pumps the heart muscles. So with high potassium, we have high pumps of the heart, leading to key terms: tall peaked T waves on the ECG monitor. Huge NCLEX tip and a big priority, because this could lead to deadly cardiac dysrhythmias, making potassium always the #1 priority. Now, some other expected findings. We see hyponatremia below 135, another big NCLEX tip, so write down that key number. Sodium is lost as fluid shifts within the blood vessels and into the tissues here. So just think, where fluids flow, electrolytes go! Now, don't let the NCLEX trick you here. Potassium is the priority here, with all those peak T waves that can lead to cardiac dysrhythmias and kill your patient. So remember, focus on any potassium higher than 5.0, because that is the priority. Now lastly, elevated H&H. So we'll see a hemoglobin that is elevated, normally between 12 and 18, and hematocrit is normally between 36 and 54%. But naturally, both of these will be elevated due to the low blood fluid volume, that hypovolemia, making the remaining blood very thick and hemoconcentrated. So that's why we see an H&H that is high when the body is dry. Now Saunders mentions, severe burn injury that covers 35% of the total body surface area. The nurse is most likely to note which finding on the laboratory report. A hematocrit of 60%. Yes, that is elevated, indicating hemoconcentration. Now, for the rule of nines. For your NCLEX and your exams, you must know how to calculate the rule of nines. Over 70% of students get these questions wrong, so be sure to listen close. A big test tip here is I recommend to write out this chart at least 10 times every single day the week of your exam, It's kind of like lab values. You need to know your numbers here. Okay, now as you can see, the rule of nines is used to quickly estimate the percentage of the body affected by a burn. This is called total body surface area, and it's used to calculate the exact necessary fluid resuscitation that is needed and require level of care for the client. So for example, the head and the neck are 9% total, 4.5% for the front and 4.5% for the back, aka anterior for the front and posterior for the back. Now the arms account for 9% total. Once again, 4.5% for the front, the anterior part, and 4.5% for the back, the posterior. And the same thing for the legs, but this is 18% total. So 9% for the front and 9% for the back. Now the most interesting part here is there's only 1% for the perineum. Wait, what? 1%? Okay, yeah. One, womp, womp, womp. Okay, now a commonly missed question here. A client has a full thickness burn to all the posterior body surfaces. Using the rule of nines, calculate the percentage of total body surface area that is affected. Guys, a lot of students get these wrong, so you must know your rule of nines numbers. Okay, now looking at the chart here that we memorized, we know that only the posterior body surfaces are affected from the question. So 4.5% for the head, 18% for the entire back, 9% for the right and left arm, and 18% for the right and left leg. So the answer is 49.5%. Now most exams ask you to round to the nearest whole number. So the answer would be 50% of the body, which makes sense because the entire back or posterior of the body has been burned here. So half the body's been burned, so 50% of the body. Now the next top missed question. The client has partial thickness burns to the anterior legs and perineum. Ouch. Using the rule of nines, calculate the percentage of total body surface area affected. Okay, so anterior legs and perineum, which includes that measly little 1% for the peri area, womp womp womp, and 18% for the right and left leg, since only the anterior is affected, or the front. So the answer is 18 plus 1 is 19%. Now, once the total body surface area is calculated, then the volume needed for emergency fluid resuscitation within the first 24 hours can be calculated using the Parkland formula. So write this down. We take 4 milliliters multiplied by the kilograms of body weight and the total body surface area percentage. Now, this is not commonly tested on the NCLEX, so I wouldn't freak out too much, but it may show up on your nursing school exams. So let's do a quick little example. Taking from our previous question, let's say the client weighed about 100 kilograms with that 19% total body surface area affected. Now we're calculating the lactated ringer fluid of resuscitation needed. So using the formula, we're taking 4 mLs times 100 kilograms, let's just say, and from the previous question, 19% total body surface area. You take those bad boys, multiply them together, and the answer is 7,600 milliliters within the first 24 hours. Now, we give the first half of fluid in the first 8 hours of the incident, so around 3,800 mLs, and the remaining fluid we deliver over the next 16 hours, another 3,800 mLs. But again, I wouldn't focus on this too much for the NCLEX. This is mostly used for your nursing exams. Now for the treatments of major burns, as mentioned before, during the emergent phase, the number one intervention in the first 24 hours, hopefully you wrote this down, we give isotonic solutions like IV lactated ringers and IV normal saline. Now, how do we know if fluid resuscitation is working or not? Well, the assessment of fluid resuscitation, big key term here, urine output 30 mLs or more. Huge NCLEX tip. Make sure to write that down. Urine output is a vital sign that indicates fluid resuscitation has been effective. So that's why we say 30 mLs per hour or less means the kidneys are in distress. Now, the second key point of fluid resuscitation is blood pressure. So 90 systolic or more and a heart rate less than 120 beats per minute. This means that fluid resuscitation has been effective. So I'd recommend pausing your screen and jotting these down. These were the most tested for fluid resuscitation. So don't let the NCLEX trick you here. Electrolyte balance is not the best indicator of fluid resuscitation. It's always urine output, then BP, and then heart rate, the top three there. So Saunders mentions, a client undergoing fluid replacement after being burned 20% of their body about 12 hours ago. The blood pressure is pretty low, 90/50, a pulse rate of 110, and a urine output of 20 mLs over the past hour. The nurse anticipates which prescription. Okay, so look at the key terms here. The BP is definitely not looking good. We're probably going to slip into hypovolemic shock for sure. So increasing the IV lactated ringer solution is the best option. Now, once the client shows adequate urine output and urinating or diuresing over 30 mLs per hour, then we can administer enteral feedings once bell sounds return. Nutrition is always a priority, but only after fluid resuscitation. This helps the client meet caloric intake required to rebuild damaged tissues from a burn. Now, as the body heals with open wounds from major burns, infection is a huge deadly risk here. So Kaplan mentions, a patient with burns who is immunocompromised, what precautions should be taken to prevent infection? Now, the key words here are immunocompromised and prevent infection. So avoid placing fresh flowers or plants in or near the client's room. Yes, we always want to avoid crowds, fresh fruits, and all the typical stuff for clients who are immunocompromised to prevent infection. Now, during the rehabilitation phase, this happens when wounds fully heal and typically takes around 12 months or so, depending on the severity of the burns. Now, the big key point to write down is that infection is not a big risk here. As wounds have been fully healed, there's no more open sores. So don't let the NCLEX trick you here. Infection is not a big risk. 80% of students get this wrong. So pay attention to the W's here for patient education. Big NCLEX tips. First W is for water-based lotion, which helps to minimize itching and scarring to allow the skin to fully heal. The second W is to wear pressure garments. Yes, don't let the NCLEX trick you here. Wearing pressure garments are good to help minimize scarring. It also helps to keep the skin and tissues tight while promoting circulation to be able to fully heal. And E is for exercise daily with range of motion. This helps to promote movement and prevent stiff joints, and we always encourage sunscreen and protective clothing when going out in the open sun to prevent those darn sunburns. Alright, that wraps it up. Thank you so much for watching. Don't forget to take the quiz and download the study guides. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. Alright guys, see you next time.